Welcome back, Lifesavers, to another NCLEX Made Easy video. My name is Nurse Kelly Tyrrell, and in today's video, we are going to be reviewing my top 6 study tips and 3 things that you'll want to avoid to help you pass your next nursing school exam or your NCLEX in the minimum amount of questions. Before we jump into the video, make sure you subscribe to my channel, like, comment, and share this video with a friend, and make sure that you click that bell icon to turn on notifications so you don't miss out on my upcoming content. Studying for nursing school exams and the NCLEX can be such an overwhelming and anxiety-driven process. Did I study enough? Am I studying the right content? Am I retaining what I'm actually studying? All of these questions and doubts, I'm sure, have gone through your mind at one point or another. But if you apply these study tips, your chances of increasing your scores on your exams and passing your NCLEX in just 75 questions will be significantly higher. So study tip number 1, schedule a dedicated time each day when you are going to study. We all know that life gets in the way, but having a very regimented study time is going to be pivotal to your success. I'm big on setting reminders on my phone to make sure I'm not losing track of the time. This actually helps me adhere to a routine. You also want to make sure you're picking a study time that's going to allow you to be fully present and engaged with limited distractions. Maybe it's first thing in the morning before the kids wake up, or later in the evening after the kids are in bed. Maybe it's while you're running on the treadmill at the gym, or listening to audio tapes in your car during the commute to and from work. Wherever or whenever it is, you want to try to be as consistent and as present as possible. This helps to avoid procrastination by forcing you to get into a routine, because having a solid routine, setting reminders for yourself, being consistent, and staying organized actually makes it really difficult to procrastinate. Study tip number 2, you want to turn off all distractions during this time, and that includes Facebook, Instagram, emails, silence your phone, turn off music, etc. This one is honestly common sense. I know that we all catch a case of FOMO, that's fear of missing out, for those of you that don't know what that means, and it's easier to just scroll on social media or respond to that text message, but please don't do it during your study time, because the more distracted you are during study sessions, then the more it's going to inhibit your retention of the materials. There will definitely be time for breaks during study sessions, which I'll cover in just a minute, but make sure that you're really focused when you are dedicating that time to study. Tip number 3, find a quiet place where you're not going to be distracted by others during your study time. I know this may be a hard one for some, especially those that have young children, and you may feel guilty removing yourself from the distraction of children or your family, but when I was studying for my exam, I told myself this is just a temporary situation. I had to make sacrifices in the short term in order to be able to provide for my family in the long term. If you don't have the ability to lock yourself in a quiet room, then go to a bookstore or a public library or a coffee shop with noise-canceling headphones. All of those places will be a conducive environment for you to really focus on your studying. And tip number 4, study for intervals of 25 to 50 minutes, because research has actually proven that we can only focus for up to 50 minutes on a single task. So again, set a timer as a reminder to take a break after the maximum 50-minute study session. And you want to take mandatory 5 to 10-minute breaks, and do not study during that time. Follow this formula to give your brain that mental rest it periodically needs. During your break times, it's perfectly acceptable to check your phone or scroll on social media, but make sure you're not getting stuck in that rabbit hole and going over your allotted break times. You have to stay consistent. Another tip to staying focused is if a topic seems too overwhelming because there's too much information to study, try using a process called chunking, which means breaking down large topics into smaller subtopics. So for example, if you're studying the cardiovascular system, you can break that down into subtopics that may include pathophysiology of the cardiovascular system, common diseases of the cardiovascular system, and common pharmacology in the cardiovascular system. So this will help you narrow your focus so you're not so overwhelmed by a ton of content. I actually use this method when I structured my NCLEX preparation course, NCLEX and Chill Review. I took the 5 main topics that are covered on the NCLEX and I broke each of them down into smaller sections. And then I actually got even more granular than that by creating lessons within those sections. So by chunking this information out into bite-sized pieces, it helps lessen the anxiety of my students and it gives them a clearer direction on actually what to study. And tip number 5, you want to take notes. Retention is so important when it comes to studying. Taking notes actually helps us retain that information. Even if what you're studying provides you with summarized notes, rewrite them again in your own words. I know I actually retained more if I physically wrote notes down myself. And if you come across something that you don't feel confident in, remember, take notes. When in doubt, write it down. Also, you want to be sure to keep your notes neat and organized. If you have trouble reading your own handwriting, then typing out notes will be a great option for you. When it comes to taking good notes, it can take some experimenting and practice to figure out what works specifically for you, so don't keep up, just keep trying. When trying to memorize medications, lab values, or other factual information, keep in mind that it usually takes a number of tries to remember something correctly. That's one reason why it's a good idea to start studying well in advance of a test. You want to try to avoid procrastination at all costs. Trust me, you do not want to put yourself in a situation where you now have to cram in that information. The cramming method of studying is not at all effective, and retention rates are really, really low with that type of studying. You also want to use special memory triggers that an instructor may have suggested, or ones that maybe you invent yourself. For example, mnemonics. Mnemonics are a great way to help you retain information and remember information, which is why I created an entire mnemonics PDF inside my NNC review program, which my students absolutely love. And in the case of nursing math, conversions, and calculation questions, do a ton of practice questions. Repetition is mastery in this area, especially when it comes to math calculation. So do a ton of questions. And tip number 6, teach what you learn to others. I know this sounds crazy, but trust me, it works. Find a nursing friend or a significant other or family member, that's anyone really who's willing to listen to you, and teach them what you're currently studying. Research has shown that teaching someone else what you've just learned helps you retain the information. When you communicate the information to others, it helps with remembering what you're actually talking about. I actually use this as a technique when I worked in the ER giving discharge instructions to patients, and it's called the teach back method. Patients bouncing back to the ER was a huge pain point for not only the hospital staff, but for the patients as well. A majority of the time, patients were returning simply because they did not understand their discharge instructions that were given to them at their prior visit. So what I actually started doing is I would teach patients their instructions, whether it be on wound care or medication management, and then I would actually ask them to teach it back to me. So it would help my patients retain what I taught them, and it also ensured that I knew that they understood what I was telling them. Now let's talk about the top 3 things that you want to avoid when you're studying. So the first don't is don't panic. Research has shown that giving students the chance to write about their fears and anxiety before an upcoming test has helped them score better than those who didn't. So when you write down your fears and anxiety on paper before your exam, you can clear your mind of those anxious thoughts that are occupying that working memory of your brain. Having anxious thoughts can block out positive affirmations and knowledge of relevant information. So give it a try. Before your next exam, free up your memory bank by just jotting down any concerns that you have and give yourself space to concentrate. The second don't is don't cram. So we covered this a little bit earlier on in this video, but it's so important to avoid last-minute cramming. Cramming will only create unnecessary and unwanted stress, and it's an extremely ineffective way to retain information. Effective studying is a skill, and just like with any skill, it takes practice. So the goal with studying is to move the information into your long-term memory bank. I tell my students when they are taking the practice exams in my course, take the exam and evaluate your score and review the rationales, then wait a few days before you retake that exam. Because if you retake the exam right after reviewing the correct answers, 9 times out of 10, you're going to score higher because of that short-term immediate recall. However, it's giving you a false sense of security that you really retain the information. By waiting a few days in between repeating the exam, you're going to get a better idea of your retention by tapping into that long-term memory bank. Also, in order for your mind to be able to use and apply information, you will need to study in small increments over an extended period of time. Don't try to cram large chunks of information in one study session. Instead, split things up into smaller increments and spend enough time on each topic until you're comfortable with the material. And my last and probably most important don't is don't lose perspective. In other words, don't give up. Failing your NCLEX or any exam is really hard, and it's going to test your self-confidence, and it's going to make you doubt your ability to persevere. So I want you to change your perspective and be thankful for your struggles, because with every failure or trial or tribulation comes growth, courage, and perseverance. Sometimes failure is one of the greatest gifts you can actually experience, because you will learn so much through your failures. So even though in the moment it's going to hurt, it's going to knock you down a couple pegs, but don't let that failure consume you and let it prevent you from getting back on the study horse. Focus on your why. Why did you decide that you wanted to become a nurse? Focus on your why and don't lose your perspective. And that concludes the end of this lesson. I hope that you found this information extremely valuable and it made you just a little more confident as you prepare to take your NCLEX or your next nursing school exam. I just want to thank you all again so much, Lifesavers, for tuning in today. My name is Nurse Kelly Tyrrell, and I help nurses feel more confident, increase their test scores, and retain what they don't remember in nursing school. Speaking of, are you a nursing student or soon to be or ready to take your NCLEX? If so, have you joined my online student community yet? If not, then what are you waiting for? The UNursity community is a complete nursing resource hub, all at your fingertips. Inside, you can expect to receive coaching, community, and content. You'll get daily coaching with your mobile mentor, me, Nurse Kelly Tyrrell. You'll also receive access to weekly educational videos that you can watch months before they even publish to YouTube. You'll also get exclusive printable digital downloads like worksheets, quizzes, flashcards, infographics, cheat sheets, skills checklists, and more. And if this video helped you in any way, be sure to give it a thumbs up. Also, don't forget to smash that subscribe button and click that notification bell so you don't miss out on my upcoming content. Also, if you can do me a favor and drop me a comment below, let me know where you're at with your nursing journey. I'd love to just say hi and connect with you. Also, make sure you click that share icon to spread the word and encourage a fellow aspiring nurse. And last but not least, when you are ready to take your NCLEX, be sure to check out my NCLEX and Chill review, where I review detailed test-taking strategies and cover every major topic that you can expect to find on the NCLEX. If you want to have that unfair advantage and pass your NCLEX on your very next attempt, be sure to click the link in the description box below. Not ready to end the study sesh yet? Well, you are in luck, because if you stick around, you can watch more of my videos coming at you in 3, 2, 1. Bye, Lifesavers.